With our commitment to quality and patient satisfaction, BIMC Hospital Nusa Dua strives to be Indonesia's premier healthcare choice.
Hey, hi everybody. Thank you so much for joining. My name is Sherry. I'm from Bali Luxe Medical, and I just want to start by saying how excited we are to be here today with the BIMC hospital team, and we have one of our favourite surgeons, Dr Astri. I just wanted to introduce our business. We own and operate Bali Luxe Medical. You're seeing some of our images up on screen at the moment. And we specialise in luxury recovery accommodation and services for post-surgical patients. Our goal is to give people a safe and comfortable space to heal when they're in the Bali, and we focus on a whole recovery experience. So we cover boutique accommodation, we cover all of your meals, daily nursing checks, we take care of transport, and our team is beautiful. They genuinely care about our guests. We want to take the stress out of your healing journey, so we will get you back to feeling your best. And we actually started Bali Luxe Medical after we saw a huge investment from the Indonesian government in recent years into medical tourism in Bali and building the industry there. The quality of the hospitals that we have here in Bali and the quality of the surgeons, as many of you are starting to find out, is actually incredible. The industry has been growing really quickly, and particularly over the last 2 years, we have grown immensely. We've seen a lot of uptake and a lot of awareness in the Australian market. It's mainly word of mouth at the moment, but what we noticed is that there was no real aftercare recovery facilities for the patients after they have their operations and their procedures. I have a background in running businesses and also a personal passion in the health and wellness industry, and we wanted to bridge that gap by providing safe and affordable recovery services. So we'll talk about a little more of our services later. What we really wanted to do is we've started to run this series of webinars with BIMC Hospital to bring some education to you all about the Balinese medical industry. A lot of people don't know a lot about it yet. So we will dig into different types of surgeries across this series, and we'll try to meet with some different surgeons as well. If you have any questions at all today, please feel free to pop them into the chat and we'll get to as many of those as we can. We've also taken your registered questions online, so we'll be talking through those. Absolutely thrilled to be collaborating today with BIMC. Just to set the agenda, we'll introduce you to their team now. Dr Astri, who you're going to meet today, will be able to present some information for you, and then we're going to start running through some of the questions that you all have registered, and anything that you put in chat as well. Have a little bit of a live Q&A session so that you can get to know everybody and get all of the information that you need. So thank you again for joining us. A huge thank you to Dr Astri and the BIMC team as well. And I'm going to pass over now to the BIMC Head of Business, who is Paramita. Welcome, Paramita.
Hello, Sherry. Hello, everyone. Hi, I'm Paramita from BIMC Nusa Dua Hospital. As you can see from the beginning at the video, we've been around since 2012. And we are located in the heart of ITDC area, that is south of Bali, tourism area here. And we have a complete services that we provide here, from 24-hour medical services and then emergency and accident services. And aside from that, we have several centers that we provide here as well. One of it is cosmetic that is significantly growing for the last 10 years here in Bali. And other centers that we have are dialysis center, dental center, pain management center. So yeah, and we are supported with 58 specialists here in our hospital. And aside from the Indonesian accreditation, we also hold Australian accreditation, which is ACHSI. I think we obtained it around 2014, 2013, 2014, around that time. And I wouldn't keep you long. I'm sure you are already waiting for a lovely Dr. Astri here. She is one of our beautiful surgeon. Okay, please, Dr. Astri.
Hello, everyone. Thank you very much for inviting me in this very, very precious moment. How are you today? Hi.
Hi, Dr Astri. Thank you so much for joining.
Thank you very much also for all of you that you want to join this webinar.
Thank you.
Shall we start with the presentation now? I'm sure everyone is already waiting.
Yes,
I think today topic would be a breast surgery, around breast surgery. Okay, so shall we?
Absolutely. Over to you.
Okay, so today I will present about breast augmentation, which is one of the most popular procedure between in young patients, especially. Okay, so my name is Dr. Astri. I'm one of the plastic surgeon in BIMC Nusa Dua Hospital. Okay, so why breast augmentation is being popular? Because breast is very one of iconic things that if we ask every man, what is the first thing you always see in woman body? They will always say it's not the face, it's the body, either the boobs and then or the buttocks. So this is one of very most of the popular procedure that we like, especially in women. So the purpose is to enhance the breast size, not only size, but also the shape, especially when we wear bikini or sexy clothes, we want to have nice cleavage in our body. We cannot deny that when we wear something pretty, beautiful, it is improve our body proportion and also increase our self confidence. So how we put or give volume in the breast, there is two things we can use between implant or the fat transfer. And I will explain more what is the difference and when we have to choose which one is we are going to use. So for the implant is already pre-made, so you don't need to take anything from your own body, but it's already pre-made, so you can choose between inside have saline or water. The other one is already silicone. Some time ago, saline is very popular because if it's ruptured, then there is no harm to our body because it's just water. Our body will absorb it back. But it's a little bit fake because it's water. Then we make the technology make another one that more natural feeling using a silicone implant, which is not silicone liquid, but there is capsule outside and silicone gel inside. And then years by years, it's already very well technology that even you do like anything, you crush it, you stretch it, it's not going to rupture, except that sharp penetration it can cause of the rupture. That's why these late days we always use silicone implant due to the natural feeling and better shape to the breast. The other different is the type of the implant or the shape. So there is like round implant. There is also teardrop implant. Our body naturally, the breast is not very round. It's a little bit like teardrop, like a little bit shape, indentation in the upper and uh, like round in the lower part. So when we choose which one you like, it depends in your own preference. If you want natural shape, like the boobs normally you don't want people to know it, then you can choose the teardrop implant. But the minus point, because if teardrop, when it's moving inside, sometimes when we move or a long time already, the implant can be misshaped. So supposed to be like this, then it can be like this. So the shape of the breast a little bit different. But if you like nice cleavage, more round, better shape of the implant, round implant is more recommended to you, especially for the patient who lost a lot of body weight or have previous history of breastfeeding. More recommended to use the round implant because our purpose is to give volume in the upper pole area. The other one is how high the implant. So same size of implant, I think people already know that. Let's say I want 200 cc, I want 300 cc. Even same amount, same volume, but there is different shape, how tall the implant. So there is we call low profile that even it's 200 cc, but it's more wide rather than go front or tall. So this one is for the patient. Mostly we use for like the construction patient that they don't want to do or fake or anything. They just want to feel the breast, that we can use low profile. And then there is like moderate plus profile, which is for the patient that wants to feel natural. So don't want to hide, don't want to fade. Then the medium profile, moderate profile is the suitable for you. But if you want more projection to the front, you want when I wear bikini, I want people can see better my cleavage, then the high profile or ultra high profile is to choose your option. But when you use it, how do you know which one is suitable with you? We will do examination when you come here and we will check how many centimeter your skin can be stretched to the front. That's time that we can decide which one is more suitable with you. And then for the implant texture. Currently in BIMC, we have two kind of implant is by Motiva and Mentor. So for Mentor, we have two kind of the texture, which is smooth and texture. Both have plus and minus. Everything in this will also always have plus and minus. So for the smooth one is more natural when you feeling it's really like looks natural breast, but because it's smooth, it's more following our skin texture. So when we are aging, the skin also will automatically going down orthotic. So you can see the droopy boobs. So the implant will always follow your tissue. Different with the texture one, it's more stick to the tissue. So it's more sometimes patient by years, they feel, oh, why my implant still upside and the tissue is going down. which is the plus and minus. So if you want more natural, choose the smooth one. If you want the texture, more fake one, then you choose the texture one. But by Mentor, they claim that you need to change your implant every 10 to 15 years to prevent the capsular contracture complication, which is I will explain in the behind. And then the other implant we have is Motiva. This is very, very famous all over the world currently that people is looking for this one because of the texture of Motiva is a little bit different with the Mentor. Mentor is smooth and then texture, this one is nano or micro texture. So it looks like smooth, but it's fixed like a texture. And also the Motiva have a technology of ergonomic implant, which is always following our breast movement. So even you run, you jogging, the implant following the normally breast tissue. So it's very, very natural. So if you have more budget, I most actually suggest to use the Motiva. But of course, Mentor is also not bad. They also have very, very good quality. It just depends on which one you choose. And then the other one is the placement of the implant. So we can put the implant above the muscle or under the muscle or dual plane, or which is half under and half above the muscle. For patient who has already big breast but they want more volume, that we can put under above the muscle because you already have tissue to camouflage the implant. Also, the plus point above the muscle of subglandular is more very, very nice sitting down, very natural, because as we know, our breast normally supposed to be above the muscle. But the minus point is for the patient who have very thin tissue, very small boobs in the upper pole. Then we don't suggest to use this one because later you will see the edge of the implant more rather than the other things. The other one we can put in under the muscle. But the minus point is if we put fully under the muscle, when your muscle moving, the implant also move. And this is very unnatural look and people very hate it. So we change the technique called dual plane. So unless not full under the muscle, we cut the muscle. So it's just half. So we use your muscle to camouflage the implant, but still the natural looking in the lower pole. And when your muscle moving, there is no any other effect in your implant. And then for the incision, many places we can incise in. If the patient doesn't want scar, we can put it around the transaxillary, also around perialveolar or in inflammatory fold. But the emplacement of the incision is very important because mostly transaxillary we cannot manipulate the implant too much. Mostly we can put it only under the muscle using this technique. So mostly we always here use the inframammary fold incision because it's also hiding and we can manage the implant placement very well with this incision. And what you have to do before and after surgery is very important to stop smoking and alcohol 2 weeks prior to surgery, and also stop blood thinner or any herbal medicine or vitamins 2 weeks before. But for other medication, we will check for you which one you can continue or which one you have to stop. For after surgery, you need to wear bra, support bra for 2 months. Also, alcohol, smoking, swimming, exercise, sauna, you can continue after 2 months. And then I suggest you to check your implant regularly. With Mentor, you need to replace it 10 to 15 years after the placement. But for the Motiva, they claim you don't need to change your implant unless there is any problem with that. And also watch the sign of infection like redness, swelling, pus, fever, or unusual pain happen in your breast. For the complication might be happen in our surgery. First will be swelling and bruises. This is very common in couple weeks after your surgery. And also don't get surprised. Oh my God, why my implant is very high? In the beginning, it will be very high looking because of the swelling. And by time it will be going down and need 1 year to get the very natural looks after your breast implant. Some patients also feel numbness in the nipple, soreness, you also get bleeding, infection, scarring, and the capsular contracture. So this is very natural complication because when we put the implant, our body is recognize this is as a foreign body. So automatically we make capsule outside. By time it doesn't make any problem, but mostly why mentors suggest every 15 years because sometimes the capsule will thicker and suppress the implant. That time you will see shape of your breast implant and you have to change it. Also, implant can be malposition, rupture, rippling, double bubble appearance, or like very low position of the implant. And then there is also breast implant associated anaplastic large cell lymphoma or malignancy. This one is very being cautious long time, a few years ago, because there is one brand with the breast implant, they recall all the patient and have to replace all the implant because can cause this malignancy. So very important to check your implant once a year and make sure where is the place you do because many place they offer cheaper breast implant but doesn't use very good brand of the breast implant. All the both Augmentor and Motiva already make long time research to check how many patients that get a malignancy from their implant, and it's very low, especially Motiva. Still there is no report for this malignancy. And then if you use fat as the augmentation, that you don't want to put anything in your body, you want to use your own fat, we can take your fat and then inject it back to the breast area. But don't forget, because fat is living things, different with the implant, it will be no stay 100%. It will be absorbed half and then stay in that area, but it can be also become lump or cyst. This is one before some sample of before and after picture. This is young woman with implant about 200 mils, high profile, 1 week after. And then this is also we use breast implant, smooth dual plane, about 350, 375. And this is also one of the breast implant augmentation we use. This is for the patient that doesn't want to more fake look, so we use the fat transfer for the augmentation. You can see the difference. So for the fat, it's just filling with the fat, so more natural looking, different with the implant, and you can really give like sitting and nice projection with the breast implant. And then mostly patient will ask when I do the lifting with the implant, when I just do the implant only, augmentation only. So if the nipple position is very low, or mostly patient have a lot of lost body weight history, or the patient doesn't have any upper pole volume and very saggy, that time you need to lift and also augmentation together. I think that's all I can say about this presentation, and thank you very much for all your attention.
Okay, thank you so much for that. That was very informative. Prior to this call starting, a lot of you registered and did submit some questions to ask Dr. Astri, so we're just going to go through some of those as well. I was having a look, and Dr. Astri, you covered some of the questions already that has been asked. So I would encourage anybody who's on the call, if you did submit some questions and you have further questions about what Dr. Astri has gone over, please just pop that into the chat and we can do a bit of a deep dive into some of those topics as well. One of the questions that we had here was around the cohesive silicone gel implants and whether or not they are placed over or under the muscle or dual plane. Is that a particular type of implant, the cohesive silicone gel?
Okay. So when mostly if the implant is smooth one, we suggest using the dual plane technique, because for the smooth implant, it is more easier to get capsular contraction if it's put above the muscle. So that time if you want to use the smooth, that time you need to put it dual plane. But if you choose texture, or the Motiva, that micro texture or nano texture implant, that you can put it above the muscle, no problem. Dual plane also no problem. Depends on how thick your tissue in that time. That time you can decide.
Okay, that's really interesting. And the next question that we have is around recovery time do's and don'ts. So what do your patients need to do in order to recover? What should they avoid in order to get the best result from their surgery?
Okay, so for the recovery, mostly patient daily, even the next day after the surgery, daily activity is okay, but mostly they feel sore. More especially for the dual plane technique, because we open the muscle, it is more sore to the patient. So we suggest at least you just do light activity, take your rest about 1 week or 10 days after your surgery. But for smoking, alcohol, exercise, swimming, lifting heavy weight is 2 months after that you can start. And the most important thing is wearing support bra is very recommended in first 2 months. We cannot lie that when I understand that many women like to go braless, they don't want to put any bra after the augmentation. But you have to understand that after we put volume, it will be make more heavy or in our skin. So it's more easy to relax and can droopy in the future. So if you can, using bra still very recommended even few months or years after your surgery to maintain the result longer.
Okay, that's really good information. And that does lead into another question that we had around breast reductions and lifts. So can you restore an original breast shape without having an implant? This particular attendee says she's currently a double D or a D size cup, and she's just looking for a lift and restoration.
Sure. Not you don't need to always, when you want to do reduction, especially because the patient reduction, they want to reduce the volume. So you already have big tissue, a lot of tissue that we can manipulate. We can use it as volume. So we lift the nipple and also lift the tissue. And then for also there is patient they want to do lift only. It's also no problem, but you have to know that we can make with only lift just like natural shape of the breast, cannot very round as like you use the implant. So you can do lifting only, reduction and lift only, or lift and augmentation on together. So it depends on what is your expectation after the surgery.
Okay. And how long is the recovery time for a breast reduction and a lift? And in particular, they're asking how long can they fly after the surgery?
For after reduction and lifting, say mostly the hardest time is just about 1 week. After that, and also we use all dissolvable stitches, so you can fly back 10 or 14 days after your surgery.
Okay, that is very, very good. Now we've actually just got a question in chat here as well. And just give me 1 second, sorry. Is there a longer recovery time if a lift is required along with implants, or is that the same recovery time?
Mostly quite same, but if you use implant together, sore will be more compared without implant. Just
Okay,
because
more pain.
with the dual plane, we put a little bit under the muscle, so it will be stretch the muscle, so it makes you feel more sore
Yeah.
compared only lifting.
Okay, okay. And we've got another question about the incisions here, around where would incisions be made? And I think, Nicole, if perhaps you can drop in chat, does this relate just to breast lifts? So would a breast lift incision be made only under the breast?
For the breast lift cannot be only under the breast, because with the breast lift we need to lift the nipple position also, so automatically there is also incision around that area. For the scar at the end, it will be like T-anchor scar, so around your nipple and then around your breast like this, and then around your inframammary fold, so like anchor scar.
Okay, I think I have seen what they look like as well. Okay, and we have a question here. How many follow-ups do you have to do after you have your surgery?
If everything's okay, 2 to 3 times follow-up is needed before you fly back.
Okay, okay. And we've got a question here around the consultations and choosing the size of the implants as well. So I'm going to bundle a couple of questions into one here. And that is, how do you choose the size that would be best for your body? And are you able to change the size of that implant after you've had your personal consultation before the surgery? How do we go through that process?
Okay, sure, of course that can. Actually, every implant, different brand, they always already make like they have the size,
Okay.
how wide the diameter, and also the tall. So mostly patient, when we come in person consultation, we will measure how wide is your base of the boobs and how tall is your skin can be stretched. Some patient also they already have like the picture. They say this is my friend about how many meals like that, and then even you bring the picture, even you already have your size, we still will measure again. If it's fit to you, that you can put it, but if not, we will let you know what is the size fit with your body. Also, especially in BIMC, we have 3-dimension imaging, how it looks like. So we will take your
That's
picture
excellent.
and make it like 3-dimension simulation, and so you can see like it commonly looks like this. But even you already have your size, you already choose your size, during the surgery again, we will also put the simulation. We will check, is it already suitable with your body? If not, we will like play around that size, like one size above or one size lower, depends on how fit and how good it looks like during the surgery. But we will not going too far around your size that you already choose after measurement and also 3-dimension simulation.
Okay, that's really interesting. I've actually got a question on that. So when you're measuring underneath the breast, if you have breasts that sit sort of far to the side, how do you correct that with the breast augmentation? Is there a risk of that double bubble happening on the outside of your chest?
Okay, so everybody, how the implants sit in our body is also based on what is our chest shape looks like. There is patient that they have flat. There is patient that they like this. There is also patient the ribs is like this. So if your body shape is already like this, even we put the implant in the middle, your body will automatically following your ribs or your bones. So there is, whatever we do, it will be always go to the outside. But if your shape of the chest of the bone is already flat, straight, then it can be stay. In other case, if the patient already have implant before, mostly when we, by years, the implant will moving, not only here, also going to outside. That time when the change implant replacement, we will stitches or make the cover,
Oh,
the
yeah, to bring
space
it
of
in.
the implant go to the middle. So we will stitch inside to make it stay in the front like that.
Okay, okay. Is that called the internal bra?
Yes, yes,
I
quite
see. I
similar.
see.
Like, mm.
Okay, excellent. We've got some questions in chat as well before I get on to the others. If somebody is having their tummy done or other surgeries, what is the best way to sequence the surgeries? Can they have it done together, or is it better to have one done before the other?
You can do it together. So we call that is a mommy makeover. So especially for
Yes.
the patient patient that already have breastfeeding or loss out of body weight, you can do it together. But of course, you have to understand one surgery you do and two surgery you do is in the same time is different. Your body reaction, your recovery, mostly more tired if you combine two surgery together. If you have short, limited recovery time, you cannot take off long time from your work, do it together is recommended. But if you have like, no, I'm afraid, I want to just make it slowly, I just want to like after surgery, less pain, then divide the surgery is recommend for you. So it depends how you expect after the recovery, but it can be done together.
Okay, okay, that's great. And can you also get lipo 360 with a breast lift and breast augmentation in the one surgery?
Lipo 360, yes, you can. If
Yep.
the
Okay.
liposuction. But if you want liposuction 360 and tummy tuck and breast, sometimes I suggest patient leave the liposuction the backside later, because when we do too wide liposuction, the complication of the seroma or liquid accumulation in the belly after tummy tuck is higher. So if you want lipo and then the breast together is okay. But if you want lipo, tummy tuck, and then lipo 360 and tummy tuck and breast, I suggest to leave the back later.
I see, I see. You'll be sore all over if you do it all together. Okay, and I think we've talked about the types of implants. I had a couple of questions about this actually around the brands of implants that you use in Bali. So is it just those two brands that you showed us, or is there anything else available? And actually, we've got a question in chat as well. Somebody would like to see a link to compare the different implant types and pricing that you have available.
Yes, currently we only use the Mentor and Motiva. There is a lot of brand also offer to us, but we just, as I mentioned in our previous, we always use only the best brand in the world in our hospital. So Motiva and Mentor is both one of the best in breast implant, and also already do long research in their implant. So we don't want to, yeah, because if something happened to the implant, later we have to recall all the patient. And both of the Mentor and Motiva has guarantee to the patient. Let's say for the Mentor, their guarantee is if you have capsular contracture between 10 years, they can replace the implant. Different with the Motiva, they have program or guarantee. If capsular contracture happen, they also give guarantee of the implant and surgery fee. How many thousand
Oh,
Australian US
wow.
dollar? Yeah.
Okay.
So they have to compare, and you can check in their website to detail. And also, when you choose your implant, there is like catalog we will give you that you can choose which one of guarantee you want to do. But yeah, but don't worry, both of the implant is already long time being established, and then it's very recommend to use. If you have more budget, I actually Motiva, but if you are okay, then Mentor is also not.
Okay, that's fantastic. That is a lot of peace of mind, I think, for people, especially when we're traveling for surgery and feeling like it might be far away if there was any complications. So Chantal, I'll just repeat what we've said there. So BIMC only uses the top of class implant types, and the two brands that are available both have a guarantee on the implant itself if you have capsular contracture with the Mentor, I believe within 10 years, they will replace the implant. And the Motiva implant, was that 10 years as well, Dr. Astri?
Yes, 10
Yes.
years, and then they also give additional fee for
Surgery.
for the surgery.
Yeah, okay, so they will also pay for some of the surgery as well. So BIMC have those details available in their catalogue, and that can be shared with you when you're booking also, so that you can make your choice. I hope that that answered your question. I have some other questions here around the drains. So do you have drains in after the surgery, and are they removed before your patients leave the hospital?
So for breast augmentation, we don't use drain. Augmentation lifting, we also don't use drain. We only use drain mostly in reduction and also or implant removal. That time we use the drain. When we remove it is if already the drain production already less, we will remove it before your discharge. But worst case, like still a lot of production that you might be need to bring the drain, go back to your hotel, and we will teach you how to manage. But mostly with the breast surgery, we will take it out before your discharge.
Okay, that's amazing. And I thought I would just touch on this for everybody on the call. The way that we typically work together with BIMC is the hospital stay will be either 1 night or 2 nights, depending on your surgery type and depending on your own condition as well. If you're struggling or if there's, you're wanting to stay longer, then you can stay additional nights at the BIMC hospital. And then typically when patients come to us, we will collect you and arrange your transport from BIMC with a nurse together, and then bring you back to the villas and take care of you from there. So certainly if you had any issues with a drain or anything like that, and you were back in our accommodation, the daily nurse would also assist you to keep that clean and to take care of it for you. So you're absolutely looked after start to finish. I do have one other question as well. This again is around surgery garments. So this was for breast augmentation and lift. You did mention earlier that we need to be wearing the surgery garments for 2 months after surgery. Is that correct?
Yes, it's correct.
Okay. And let me just go. Sorry, we have so many questions here. Nicole has just asked in chat, are the surgery garments provided as part of the surgery fee, or do we need to bring our own?
In BIMC, yes, it's already include one for the garment, but sometimes patient they want to wash it or they want to change every day. In that case, you can also buy here or you bring some spare one from your own country. So you just use buy first and then just buy 2, I think, because sometimes it will be changed the size because the swelling going down, the size also getting different. So maybe bring one from your country and one from here is already enough.
Okay, fantastic. And I've got some other questions here as well. What else can we do during recovery to help us to recover faster and to have less scarring?
Okay, so for the recovery to make it faster, you can do some light therapy, also good. Oxygen chamber therapy also recommended. The other part is immune booster. Using also you can do like some infusion that is contain vitamins to enhance your immunity and also together faster the healing process. And then for the scarring, we will let you use after we take off the dressing. The stitches is dissolvable one, but you can use like silicone gel or silicone type scar, tape scar to that area to reduce the scarring.
Okay. And I will also jump in there because that's all therapies that we offer at Bali Luxe as well. So when our guests stay with us, you will receive, and I've just seen a question come through. So the red light therapy is something that we have in-house, and we have some very good quality machines. So you'll receive a red light therapy on every day after your surgery when you check in with us. And I know for boobs, it's not quite as relevant, but it also helps to reduce swelling. So if you have had some liposuction or anything like that, even though your incision point is very small, the anti-inflammatory can just take your swelling down, which actually reduces the pressure on those wounds as well. So really, really helpful. We also have the hyperbaric oxygen chambers. We have a partnership with the top provider here on the island, so we can get you out there every day to have some hyperbaric oxygen therapy, and also the IVs and nutrients on site. So that's great. We're all in line there. We've got another question. Does having an autoimmune disorder affect having surgery or getting implants?
It depends on what kind of autoimmune you have, but even you have any other sickness, we have to check also the blood and make sure with our anesthesiologist. For the autoimmune patient, currently we still do it unless patient who have allergy to the implant, which is very, very, very rare that we don't put the implant. But even we already do it, we cannot know because sometimes even the normal patient, they can react to the implant. If that sign happen, like you always get sickness in few couple of months, like always getting fever, you don't know what is the reason, fatigue, that time you have to check the implant condition, and if that is really because of the implant, and we have to take it out for your implant.
Okay. That's really good to know. I had a question as well around keloid scarring. So is it possible to have breast augmentation if you have keloid scarring, and would you change the incision position or would you change anything about the procedure to manage that better?
Okay, so for the patient who have keloid history, all the incision placement for the breast implant, all is easy to get keloid. The axilla and then the chest area is very easy to get keloid. Luckily for the Western people, because they have light skin, it's very less less possibility to get the keloid. But maybe you already know that the darker our skin, the easier to get the keloid. As the different in the beginning prevention, silicone tape is the best option. But later, if starting to get higher, that time you can do the injection, a steroid injection, to reduce the highness of the keloid. But some patients who have very, very high possibility to get keloid, we already start the injection directly after the surgery. So after the incision, we directly inject the time to prevent it happen.
Okay, that's really interesting. And so, do you recommend that those patients only use the incision in the armpit, or do you recommend that they can still have a normal incision and then manage the scar afterwards?
Still suggest to use in the inflammatory form.
Okay. We have another question around the pre-work. So what is required for the pre-testing before surgery, and will they have their bloods done in Australia or will they have their blood work done in Bali?
Okay, so for check things, mostly we need the blood check, and then also the X-ray and electrocardiography of. For that one, you can choose. If you more easy for you to do it in Australia, we can give you the list what kind of check we need. But if you don't want to know, I don't want to do anything, then you can come here directly during our consultation in person. We also check your blood later and also do ultrasound of the breast in same day. So you don't need to do anything, just come and do everything in Bali. But for special case, like patient have other illness already, like thyroid or anything related, sometimes we will suggest to the patient check what test you have to check there, because if let's say your thyroid level is too high or too low, sometimes you have to postpone the surgery, and this is make patient is very uncomfortable since you travel from other place. So if you have that kind of disease, mostly we ask you to check there and make sure it's already in normal limit before you come, like that.
Okay, that is really good to know. Okay, I'll just give a minute. I can see a couple of people typing. We've got a couple of minutes left to go through some additional questions if we want to, before we make some announcements, and that one will be finished for today. Perhaps let's just talk about BIMC. So,
Okay.
do you do the revision for reconstruction?
Okay, so for breast reconstruction, currently we are very limited with that one. If this tissue is still okay, that we can use, we can do. But if already like total mastectomy, you already not have tissue that you need like some flap from the other part of your body combined with the implant. Currently, we are not providing in BIMC. Mostly our surgery proposed is for the cosmetic surgery, not the reconstruction yet.
Okay, that's good to know. Okay, I know that there's still a couple of questions coming through, but we are getting to the end of our time. So feel free to pop them in. I will try to get back to everybody on chat. And of course, we're going to send through a link for this session, which is being recorded, as well as the links for booking. So everybody will have all of the information that we need. And I did want to announce something for this call as well, because it's actually Bali Luxe Medical's birthday coming up. So we have been running now for almost a year. In
Congratulations
September,
for Bali
thank you so
Luxe.
much. Thank you so much. And BIMC, of course, are one of the very first hospitals that we started to work with, because they're world renowned, and just the quality that they have is excellent. So we have a little bit of a surprise for everybody. This is going to be put up onto our socials later, but you are all the first people to hear about this. Because it's our birthday, we wanted to give away some gifts. So we will be running a giveaway over the next month, and somebody can win a free stay with us. So we have a 4-night Bali escape. You'll be able to stay in one of our rooms in our villas. And it is 4 nights in all-inclusive. So you will have our chef preparing your meals for you. Of course, with everything, we take care of airport transfers and hospital transport, and you'll have your daily nursing checks as well as that LED. So you will be completely looked after. Now, I do want to make clear as well, Bali Luxe Medical, we don't charge extra for companion stays. So if you need to bring a friend with you, or if you need to bring your husband or your sister or whoever it is who wants to come, we often have people sharing rooms, and there's no extra cost for that. So this prize is for you and a friend if you would like to bring somebody, and we can help you to arrange that. So all you need to do is follow us, please, on Instagram as well as on our Facebook page, and then tag a friend who you might want to bring to Bali. You can tag somebody who might be interested in surgery already. You can tag as many people as you like, and every new tag that you put in will be 1 entry. So we will be drawing this at random at the end of September, and you'll all be notified, and the winners will be posted on Facebook as well. Okay, I think that's it. I can see Chantel had another question there. If you've got anything else you might like to ask Chantel, please feel free to get in touch. We can actually put you in touch directly with BIMC also, so you can have a chat to them about the different options available to you if you would like. Is there anything else you might like to cover, Paramita and Dr. Astri?
Yes, Sherry, for the ladies who hasn't had the chance to ask the questions, don't worry. Just share with us your emails, and we will get back to you with the answers for all of your questions.
Definitely. And we'll continue running these series. So we're going to see Paramita and Dr. Astri again.
And next we will do a lipoabdominoplasty. Yes, Jerry?
Excellent, excellent. I'm just going to pop that in the chat. So we're running these semi-monthly at the moment. So within a month, 3 or 4 weeks, we'll be posting the dates onto our Facebook page, and you'll see them on BIMC as well. And we're really excited to continue this series.
Yay!
Thank you everybody for joining. You've taken time out of your Saturday morning, and we really appreciate it. It's lovely to have these sessions. Thank you so much, Paramita. Thank you,
so
Dr.
much,
Astri. And thank you to the team
everyone.
behind the
Thank you. Have a
scenes as
nice
well.
day. Bye-bye.
Thank you so much, everybody. Bye.
Thank you.
Bye.
Bye.